Hi, Medpy.
Hi, Dr. K.
So, this is your first time visiting me as a gynecologist. Have you had an exam before?
I did, yes.
Okay, what was your last exam?
It was last year in November.
Okay. So, you're definitely due. Can I verify your first and last name and your date of birth?
Medpy,
Okay.
ASMR, June 2nd, 89.
All right. And do you identify as transgender?
No.
Okay. So since this is your first time with me, I'm going to ask a series of questions just to make sure I can get to know you very well and we're familiar with each other. I'll be checking your breasts for any discoloration, lumps, any abnormalities, as well as your pelvic area and your abdomen. Okay? So I need to ask, are you on any medications right now?
I'm taking birth control
Okay.
pills.
And what kind?
Honestly, I don't remember. I thought it's going to be in my chart.
Okay, I'll have to double check that. I don't see
Yeah.
it here, but we can look at it on our computer.
Yeah, I just started them.
Okay, great. All right, are you suffering from any medical conditions?
No.
Okay. Any allergies to drugs, nuts, or latex?
I'm allergic to penicillin.
Penicillin. And when was your first period?
I was 12, I think.
Okay. And how many days are typically between each period?
3 to 4 now.
Okay. Oh, in between each?
Oh, okay. About 28 to 32 days.
Okay, and that's pretty consistent?
In the last couple of months, yes.
Okay. All right. Have you had any inconsistencies with your period before that?
Well, kind of. I was on some medication in the spring.
Okay.
And after that, I don't know what happened.
Okay.
My period just was every 16 days.
Okay.
And that occurred for about 3 months.
Okay.
And then it was back to normal.
All right. That's good to know. Definitely medication can change that. And since you just started the birth control, I'm sure you were told when you started it that you can expect some irregular periods for a while as your body adjusts, depending on what brand that you have.
Okay.
Okay. So, and you said each period lasts 3 to 4 days?
Yes.
Okay. Any pain during, before, or after your periods?
No.
Okay. And have you received the Gardasil vaccine?
No.
Okay. Are you interested in that?
No.
Okay. And when was your last menstrual period? Can you give me a date?
It was 4 or 5 days ago.
Okay.
Yeah.
All right. And the date of your last pap smear?
2 years ago.
Okay. We'll be doing that today for sure. And have you ever received any abnormal results from a pap smear? Okay. Are you currently sexually active?
Yes.
Okay. Have you ever had a mammogram?
No.
Okay. Have you had a bone density test?
No.
All right. Or a colonoscopy?
No.
All right. Any surgeries in your lifetime?
Just a C-section.
Okay. Any hospitalizations for any reason?
I was hospitalized for when I delivered my babies, and then in the spring I was sick. I had a strep throat.
Okay. Okay. So you required hospitalization for that. How many days were you in the hospital?
2 days.
Okay. Sorry to hear that. Okay. So I'm going to ask you a series of more questions now, but this time I want to know if this applies to any of your immediate family. So your mother, your father, any siblings.
Okay.
Okay, and as well as your grandparents.
Okay.
So any ovarian disorders?
No.
Breast disorders?
No.
Colon disorders?
No.
Diabetes?
No.
High blood pressure?
No.
Okay, what about heart disease?
No.
All right, and how many siblings do you have?
None.
None? Okay. Do you smoke at all?
No.
Do you use any recreational drugs?
No.
Okay. And do you exercise?
I do.
Okay. Do you do aerobic activity? What kind of exercise do you do?
I do like cardio and weights.
Oh, wonderful. That's very good. Okay, so I want you to go ahead and write your name and date of birth and sign this right here, and that will give me consent to do the exam. Great. So we're going to take your vitals and then begin.
Okay, thank you.
Great. I'm going to go ahead and take your oxygenation and temperature. So can I have your index finger? Thank you very much. Okay, 98.1. And very good. You're at 98th percentile of room air. Do you have an arm preference?
No.
Okay, let's go ahead and use this one. Okay, make sure your legs are completely uncrossed. All right. Okay, you're 119 over 79, which is perfectly normal. Okay, I'm going to take this. All right. And listen to your heart. All right, go ahead and breathe normally. Okay, sounds normal. Very good. Listen for any murmurs. Okay, no S3, only S1 and S2 are present. So we're going to go ahead and begin the exam, the wellness exam. So I'm going to give you a gown to change into, and do you have any questions before that?
No.
Okay, great. So do I have your permission to open the gown?
Yes.
Okay. Okay. Your breast looks symmetric. I see no discoloration, no discharge. Okay. Do you mind if I palpate?
Sure.
Okay. Okay. I'm not feeling any lumps or masses. Going to move on to the right. And you can do this once a month in the shower after your ovulation is finished. It will give you a better gauge. And if you feel any lumps or any kind of firmness that wasn't there before, definitely you need to get that checked. But I don't feel anything right now. It looks and feels very healthy. Okay. Okay, I'm going to go ahead and check the armpit area.
Okay.
Okay, just feeling your lymph nodes. Alright, they're non-palpable. I'm going to go ahead and check the other side. Okay, you could go ahead and lift it. Yes, very good. Sorry if this causes some slight pain. I don't feel anything. Nothing to be worried about. You might have a bit of soreness in the armpits for a couple days. Okay, but that's completely normal.
Okay.
Okay, I'm going to go ahead and put this back. Okay. You're a little young for a mammogram, but if you're interested in preventative care, we can set you up with an appointment. You can talk to our receptionist after we're finished.
Okay.
Okay, I'm going to have you lay down and we're going to start the vaginal exam.
Okay.
Okay. Okay. Okay, so first I'm going to visually inspect just to look for any lumps or discoloration. Okay. All right. I'm not seeing any cysts, any lumps. Okay. Everything looks very healthy. No discharge. I'm going to gently palpate just to make sure there's no swelling. Okay. Okay. I'm just inspecting for any polyps in the canal. Everything looks very healthy so far. Okay. Alright, next I'm going to do a pap smear. Using my speculum here, I'm going to open up the cervix. I'm looking at the vulva and the uterus. Okay, so it's going to feel a little bit cold. Okay, very good. All right. All right, I'm just going to take a sample here. Okay. And on the count of 3, take a deep breath in and out. 1, 2, 3. Okay. And your uterus feels a normal size. All right. Be feeling a few stitches in the cervix. In the next 24 hours, a little discoloration is going to be natural. But that will go away. Okay. All right, everything looks and feels very normal. We'll call you with the results in about a week. Next, with your permission, I'd like to move on to the abdominal exam and just feeling your pelvic area from the top and also the organs in your stomach, okay? All right. Okay, Matt B, and with your permission, may I go ahead and lower the blanket and lift your gown so I have access to your abdomen?
Yes.
Okay. And if at any point you feel uncomfortable, please let me know.
Okay.
Okay. Okay. I'm just going to feel your lymph nodes right here, just going a little bit lower. They are normal in size. All right. I'm going to be listening for your fluid and doing some percussions. Okay. any pain as I'm doing this?
No.
Okay. Okay, just going to take some measurements for symmetry. Okay. 20 centimeters on the right side. 21 on the left. Which is consistent. Okay. 25. So 32 on the left. Sorry. Flip it over here. There we go. That's 14 inches. Just get on the upper quadrant. That's 6 inches in the center. Okay. It's 12 inches in the pelvic floor. Okay. Just doing a couple more here. That's 10 and a half. From hip to hip. 10.5 hip to hip. And we'll do that on the other side here. Okay. 12 inches on the left side. On the left. Okay, I'm just going to be going from here. 18. Okay. Okay, and that's 10 inches. So. Okay. I'm going to be doing a few sensory tests on the abdomen before we conclude.
Okay.
Okay. So this is going to feel like a sharp sensation, and this will feel dull. Just relax and let me know which one you feel, okay? Yeah, let me get this out of your way here. Okay, so sharp or dull?
Sharp.
Good.
Dull. Dull.
Okay.
Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. 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 Sharp. Du sharp, dull, dull, dull,
Good.
sharp, 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 dull, dull.
Okay, good. Testing your reception to temperature. This is going to feel like a warm sensation, and this will feel cold. So go ahead and say warm or cold, okay?
Okay. Cold, warm, cold, warm, cold, cold, warm, cold, warm, 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 cold, 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 warm, 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 cold, cold, cold.
Okay. We're going to do one more before we conclude. This will feel like one pressure point. This will feel like two. Let me know if you feel one pressure points or two, okay?
1, 2, 1, 1, 2, 1, 1, 2, 2, 1, 1, 2, 1, 1, 1, 1, 1, 2.
Okay, very good. I'm going to have you sit up and we're going to discuss the results, but everything in your abdomen is perfectly healthy. Okay. Okay, Magpie, everything that I felt and that I saw came back completely normal. We did take some samples for the pap smear, and that's going to be back within 1 to 2 weeks, and we'll give you a call.
Okay.
Okay, but there's nothing to be concerned with here. You seem very healthy and good to go for another year. Do you have any questions?
No.
Okay, great. Well, thank you for allowing me to do this exam and for prioritizing your health.
Thank you so.
All right. Bye.
Bye.